Good evening. My name is Randy Hurley. I am a medical oncologist at Regions Hospital in St. Paul and a member of Shepherd of the Valley Lutheran Church in Apple Valley. I'm a co-founder of Shoulder to Shoulder.
Hello, and thank you for tuning in. I am Dr. Gary Moody. I am a family physician with M Health Fairview. And since they made me a member of their tribe, I will therefore represent the Lutheran Church of Ilula, Tanzania tonight.
So welcome to our annual event, supporting Ilula Hospital and Nursing School. We all know things are a little different this year, and I think the key to these changes is adaptability. Many of you have gathered with us annually for the past 15 years at an in-person fundraising event where we're able to share a meal, perhaps some wine, hear some music, and tell some stories from the podium. Of course, things this year are quite a bit different. Gary and I have had to learn to adapt to a virtual fundraising event. I'm also hoping that things are different in a good way. Perhaps more of you can attend virtually tonight than would have been able to attend at an in-person event. And you will see tonight that we are able to feature more of our Tanzanian colleagues by video. Thank you for joining us.
Ladies and gentlemen, the focus of this year's event is maternal and child health at the Ilula Hospital. Specifically, due to extreme need, we wish to rebuild and enlarge the labor and delivery building and also the reproductive child health building. This is an advanced project, and with many large projects, it will be done in stages. Because these two areas are currently located right next to each other, before we can address the labor and delivery space needs, the RCH clinic needs to be moved. So this evening, we will be focusing on the first phase of the project, the need to expand and improve available RCH space, that is maternal child health space, to meet the fast-growing demand, and you will hear more about the demand later. As I said, this is a big project, but we started out small, and Dr. Hurley will say a few words about how we began.
So, I am thankful for a whole lot of things in my life, but one of the things I am most thankful for is having been able to be involved with Shoulder to Shoulder with Gary, my family, and our board of directors. You might ask, how did we get here? I often think it was actually by the grace of God. Their companion congregation groups met in Tanzania 18 years ago. Gary was with his wife Sharon and family and a group from his church, and I was with my wife Kari, my son Evan, and daughter Angela, and 6 other members of our church. In fact, all 6 of those members continue to be active in projects in Tanzania, including Kirsten Leverson, Linda Molly McLean, Peter Harritz, and Pastor Bonnie Wilcox.
As Randy said, I'm also in awe of what's been accomplished since we began this relationship. I do want to recognize we wouldn't be anywhere without our donors, a member of our Shoulder to Shoulder group, our visiting medical professionals, and the foundation which support us. But we have had some successes, which I'd like to list a few of now. We built an operating room. We built an X-ray casualty building, and this year installed a new digital X-ray system. In spite of troubles with the coronavirus, we obtained ultrasound, and we trained the staff on how to use these things. We also started a large educational function. We have a classroom building, kitchens, and dorms. We started a nursing school. And the Ilula folks started a clinical officer school, which is kind of like a physician assistant school. We've built guest housing where we can stay when we visit there. And in terms of infrastructure, we drilled a new 8-inch casing well, we obtained a generator, and we obtained an ambulance. We basically saw Ilula transformed from a small health center to a hospital and then to a district hospital and a busy one. So at this time, I'd like to introduce the third member of our panel tonight, Glenn Flattable. Glenn is a master auctioneer and event planner. He's been a friend of the Ilula group for about 15 years. We're pleased to have him today for this virtual event. Glenn.
Dr. Moody, thank you. I am delighted to be here tonight and grateful that all of you at home are rallying and joining us tonight for our first ever virtual event. As Dr. Moody said, I have been involved as the auctioneer for many, many years. I have cherished the time that I've spent with you in person, and I've thought of all of these projects over so many years that we've raised money for. I will say, Dr. Moody, and I believe this, I believe tonight's project is the most important one that I've ever been involved with Shoulder to Shoulder. This is a big deal. The need is greater than ever right now. Since 2007, basically our campus has stayed the same, but the people that we've served has increased dramatically. We've went from serving 700 kids a year to now over 14,000. The number of moms that we've served have went from 480 to over 2,700. And simply put, we need more space. So tonight's goal together is to complete phase one. And phase one will roughly cost just over $100,000. So right now we're at $30,000, but essentially we're at $60,000, and here's the reason why. The Peter J. King Foundation. Many of you have seen their names and buildings across the Twin Cities. You've heard about their generosity for many, many decades here in Minnesota. Several years ago, Peter King himself found out about Shoulder to Shoulder. He traveled to Tanzania with Lamont. He heard about the organization. He became passionate about this group. He's made gifts in the past. Their foundation has made gifts. And tonight, the Peter J. King Foundation, this is a big deal. It's the single largest match that we've ever had at this event. They will match every gift dollar for dollar that we raise. Even if we get past $100,000, they will still match all of the gifts to make phase one happen. We want to give a heartfelt and personal thank you to the foundation, the Peter J. King Foundation, their board. Many of their board members have traveled. So right now we're at $30,000 before their support. So what we'd love to do is get to $50,000, and then with the match, it'll mean $100,000. Dr. Moody, I will tell you this, many of you probably know this, but I am an ELCA, I'm a classic ELCA Lutheran Norwegian Minnesotan. But if we get to 100,000, you're going to see Lutheran energy like you've never seen before at the Shoulder to Shoulder event. We're going to do this together. You can pledge throughout the performance. Dr. Moody, we're going to do this together.
Cool, Glenn. Good to work with you again. So for the next part of this program, we'd like to take you over to Africa a bit, hear from some of the voices there. So we're going to play a short video. Dr. Hurley will virtually introduce our good friend, Dr. Saga.
I'd now like to take this opportunity to introduce our friend, Dr. Mufwimi Saga. I know Gary still remembers our first visit to Ilula 18 years ago. Gary, myself, and our companion congregation church groups had planned to visit the Ilula Center to better understand the challenges to healthcare in Tanzania. In that group, we had 5 healthcare professionals. Gary and I, Kari, my wife, a nurse, Linda Held, a nurse we worked with in Hastings, and Gay Menke, a physical therapist. We were greeted by Dr. Saga, the doctor in charge, and his wife, Dora Saga, the head nurse at Ilula. We, of course, were struck by the differences in resources. We thought of what a modern private birthing suite looks like in Minnesota and compared that to the open wards in areas where young mothers gave birth at Ilula. But what really impressed us, actually what really grabbed our hearts, was the perseverance of the healthcare providers that we worked with at Ilula. Dr. and Dora Saga had essentially dedicated their lives to Ilula in this underserved, resource-poor area. They had raised their families there. You know, anyone with experience in cross-cultural partnerships understands that the ultimate success of that partnership depends on the strength of the relationship. Well, everyone who has visited Ilula knows Dr. Saga, his warm smile and generous hospitality. Our families have grown together. Our family has stayed in his home and visited with his children every time we travel to Tanzania. And he and his family have visited us multiple times in Minnesota. Dr. Saga is now retired, but still lives just outside the hospital campus. Sadly, Dora Saga died of complications of Hodgkin's disease in 2013. Their family, however, has developed a memorial fund in her honor to support nursing students and other privileged women in the Ilula area. Let's now hear from Dr. Saga as he speaks to us from the Maternal Child Health Facility at Ilula.
Hi, my friends in Minnesota, US. I greet you in the name of Jesus Christ. My name is Dr. Mufwimi Saga. Here is a brief history of how the shoulder-to-shoulder partnership started at Ilula. It was in 2002, Dr. Randy Hurley and Dr. Gary Moody came to Ilula for the first time. Dr. Randy, he was with her daughter, Angela. During their visit to Ilula Health Facility, they found that something has to be done. There was no operating theater. There was few medical equipment. There was a shortage of staff. Seeing and hearing all these, Angela Hurley, 10 years old daughter by then, told her daddy that you have to help these people. What has it meant to have shoulder-to-shoulder partnership? It has meant by bringing some impact to Ilula community and the entire community of ELST Iringa Diocese. We have been supported the following: construction of a modern operating theater at Ilula Hospital, construction of casualty building at Ilula, construction of Ilula Nursing School buildings, provided funds for scholarship for medical staff and nursing students, successful Ilula, Minnesota International Healthcare Conference in Iringa for 24 church hospitals training institutions from Southern Zone of CSCC in Tanzania. I have to say a word of thanks to the following individuals who made possible for their contributions: Shoulder to Shoulder and the Board of Directors, Will and Jane Carlson, Peter King Family Foundation, Global Health Ministries, sister congregations from St. Paul area city, all pastors from sister congregations who made this support possible. Thank you.
This is Dr. Moody speaking to you from the virtual world. It's hard to say enough about Dr. Saga. He has dedicated his whole life to the Ilula Hospital and the patients seeking care there. He raised his family of 5 right down the street. He's one of the first persons we met when we came to Africa. I remember how he would take our first medical groups right into the hospital on rounds and introduce us to the medical practice in Tanzania. He had a top 10 list of diseases, including malaria, respiratory infections, diarrhea, illness. I remember telling my partner, Dr. Hurley, that when we can make rounds here on our own, we'll know we've come of age. For those of you who don't know, Saga almost gave his life to one of our projects. On the way home from a meeting to certify the nursing school, he was hit by a car. He broke one arm, one leg, and had a head injury, but he recovered, a little the worse for wear and tear. He's been our main liaison at the hospital with the schools and coordinating exchange visits with the students we bring there. He's retired from medical practice now, but still chairs the board of the nursing school. So to Dr. Saga, I would like to say in his own language, Twilumba Hilo Muganga. I know you didn't understand that, but it roughly translates to thanks a lot, doctor. You heard Dr. Saga refer to some projects, and Shoulder to Shoulder would like to extend a special thanks to the Will Carlson family, which was instrumental in the construction of the operating room and the X-ray casualty building and multiple dispensaries. Also thanks to the Peter J. King Family Foundation, which sponsored the main classroom building and the dormitories for the nursing and clinical officer schools and the faculty and guest houses on campus. The current doctor in charge at the Ilula Hospital is Dr. Benjamin Chota. He's a dedicated young guy, a respected clinician, and a stabilizing force within the management team at the hospital. He was instrumental in the new X-ray project. We will hear from him now by video from Tanzania as he provides an update.
I would like to give greetings to all friends in Minnesota and Shoulder to Shoulder. This is the general introduction of Ilula Lutheran Hospital. This hospital was founded in 1939 as the health post, and in 1992 we have a health center, and in 2007 this one was recognized as a district hospital. We have many activities that is done in this hospital, and the number of the patients have been increasing year by year. currently we have received, we have introduced a new department, which is radiology. And in this department, we have received a new digital X-ray. Most of the patients who needed the service of the X-ray were supposed to be referred to Iringa Regional Hospital for this service. And in 2018, we referred almost more than 1,000 patients to receive this service in Iringa Regional Hospital. In August 2020, we received a new digital X-ray machine. This X-ray is one of the best X-ray in the southern zone of Tanzania. Number of patients that have received service in this X-ray since the installation in August to October were 2,076. And within this department, we have ultrasound machine. From March to October, patients that received the service from ultrasound were 1,669, and those who came with the gynecological problem were 318. We can go inside and see the new digital X-ray, and we can give more detail on this X-ray machine. You are most welcome. This is the waiting area for the patients who are supposed to receive service in this X-ray. You are welcome to see this new digital X-ray which you have been received from the partner Shoulder to Shoulder. So this is the table where patients come, and when you want to take maybe the X-ray of the limb or abdominal pelvic X-ray, we tend to use this table. And this is the chest, which most of the time can be adjusted according to the size of the patient that you want to take the picture. The patient comes and stands here. And after having this one, we have the detector, which this detector can be shifted from this chest to the back, where the patient can sleep when they have the X-ray. So this is the X-ray machine, and we have received it on August as the donor from Shoulder to Shoulder, and I think we should give thanks to our partner who have been working with us for many years, St. Paul's Synod, all members for Shoulder to Shoulder, and all donors who have been spending their time and money to make sure that they support and help people of Ilula and Iringa in general. Thank you.
Well, thank you, Dr. Chota, for a demonstration of the new radiology unit installed at Ilula. It's actually the only facility of its kind in the entire Kololo district of the Iringa region of southern Tanzania. The building itself was made possible by funding from the Will and Jan Carlson Foundation. Our good friend, one who wears many hats at Shoulder to Shoulder, Dr. Ken Olson, provided the project planning, and you all, as supporters, helped fund the purchase and installation of the equipment this past summer that occurred despite the COVID pandemic. All this demonstrates the remarkably collaborative relationship that makes Shoulder to Shoulder an exciting and impactful organization. Now let's go back to Glenn for an update.
Dr. Hurley, we are making progress. Look at this, everybody. We have just over $9,500 to go to hit our goal of $50,000. Thank you, everyone, for donating. We are getting closer and closer by the moment. Dr. Hurley, I've also been thinking about this. I'm excited myself about what this expansion means. I mean, when you think of the additional space for the moms and the kids, but also the staff, not only right now during a time of COVID, but what it'll mean for expansion in the out years, this is a big deal for us. And Dr. Hurley, when I'm with you on the stage, I want to say to you, You know, I have been in the nonprofit business for many, many years, and it is very hard to create a nonprofit. It's especially hard to do one that serves international communities. I am grateful for what you've started. Thank you, Dr. Hurley, for the commitment that you've made. This is a big deal, and it's exciting tonight what we're doing.
It sure is. Thank you, Glenn. We're going to return to Dr. Moody now as we focus on the specific needs of the Labor and Delivery and Reproductive and Child Health Clinic at Ilula Hospital.
This is Dr. Moody again. As you might imagine, in rural and small town Africa, life can be very difficult. Consider poverty, lack of food and water, mosquitoes that carry malaria, and an HIV epidemic, to name a few items. If we focus on the OB and maternal child issues, please picture this. A woman in labor in a remote area might have to walk for several miles and then perhaps ride a motorcycle to get to a hospital. Prior to the operating room at Ilula, she would need to go another 70 kilometers for help. Mothers and babies could be dangerously stressed. I am a family physician. I have seen maternal deaths at the Ilula Hospital, but I never saw one in 33 years as a family doctor doing deliveries in Minnesota. Just before one of our visits, a woman died during a C-section because the old generator failed and the power was off. Another woman died of infection. Fortunately, with our help, the hospital has a new ambulance to help transport patients from distances. We have C-section capability in the operating room, and we have a new generator funded by an anonymous donor. I can truly say that donations through Shoulder to Shoulder have saved many lives. This brings us to our current problem. When we first visited Ilula, the hospital had about 1 or 2 deliveries daily. That number has now increased to 7 to 8 deliveries per day. The labor and delivery ward is overflowing. Sometimes there are 2 or 3 women per postpartum bed. There is, of course, an increased infection risk. This scene is almost unimaginable from our perspective. Also, the outpatient clinic only occupies a couple of small rooms and needs a rebuild. It's time for an upgrade to OB and maternal child care. In the next short video, we will go back to Tanzania. We will bring back Dr. Chota and also Alam Kikoti, the hospital administrator, and they will speak of the challenges they face. There may also be a special appearance by our friends nurses Rita and Tuli, who we know and love.
This is another department, which is labor and delivery. It's one of the busy departments also in the Ilula Lutheran Hospital. And if we compare in numbers, in 2010, number of delivery keeps on increasing year by year. And in 2010, number of pregnant women seen in Ilula Lutheran Hospital were 480, while in 2019, the number of pregnant women seen in Ilula Lutheran Hospital were 2,722. Total number of delivery in 2010 were 1,630, while in 2019, number of delivery were 2,722. Also, labor and delivery works together with the RCH, that's Reproductive and Child Clinic. Number of children under 5 who were seen in 2010, they were 778, while children under 5 who came to receive service in our RCH were 14,799. After saying all those, I think I should welcome the administrator of the hospital so that he can explain what's the plan forward, because the number of patients we are receiving daily or monthly keeps on increasing as the year goes. But the buildings and the other infrastructure remain the same since we have started this hospital in 2007. So you are welcome, Mr. Alam Kikot, to take over in this scenario so that you can explain what would be the way forward.
Thank you very much for having this opportunity to explain about the way forward to overcome this problem of overcrowding of maternity ward and labor for delivery. So after discussion in 2009, in January, and this year in January, we come to conclusion that we have to make a research to some hospitals where they have modern maternity ward. Now, last year in 2009, we went in Iringa region together with Dr. Kenneth Olson to visit the maternity ward and labor to see how it is modern. Now we come to the conclusion that we have to sign out our architecture, Florence Malul, to come out with drawings and BOQ. Now the BOQ which we had now, it has almost 117 beds, together with all parts which is required to be in maternity ward. The total cost of renovating and expansion of maternity ward, it will be USD 255,000. But before expansion of maternity ward, one important task which we are supposed to do is to remove reproductive and child health to other areas. And the cost of building reproductive and child health, it will be 110,000 USD dollars. So by this time, currently, we have 22 beds in maternity. So we need, very important, we need this expansion to take place soon if it is possible to get money in order to reduce this challenge in our hospital, because the number is increasing. And one important factor of increasing this number is the policy of the government to reduce maternal death and neonatal death. So you find that the cost of services to pregnant mothers and children below 5 years, it is free of cost. It is subsidized by the government. So because of this policy of the government increases the number of mothers to come to deliver to the health facilities. So we need to expand the maternity wards and to have new reproductive child health. Thank you.
Okay, as we have been talking throughout the day outside, this is another special room where most of the pregnant women who have delivered, they come to stay here for more than 24 or less so that they can be discharged. Here are some of the nurses, and I would like to introduce Rita Tesha, who is the head of the nurse, and on the other side this is Turiumi. She is also working here in the Rural Lutheran Hospital as a nurse and a nurse educator. So Rita Tesha, you are welcome to take over this so that you can continue the discussion.
Okay, thank you very much. I have to have the greeting to all my quarters members. And my name is Rita Tesha, as Dr. say. I'm a nurse by profession, also I'm a hospital matron. As we have heard from the doctor in charge about the cares we giving to our patients since the hospital was started, we have been meeting a lot of challenge according to few space, and we have receiving a lot of patients. So as sometimes we make us the difficulty to give a nursing care. As you see, the room is too small while the patients are too many. Sometimes we can face that one bed consists of 2 mothers and 2 babies, and sometimes they sleep on the floor. So we make it as difficult to the nurses to provide a good care, and sometimes according to this overcrowded, we can increase the risk of infection. So our request is to extend these wings so we have a big space so it can be good to us to provide a good nursing care to the patients and making a good arrangement so as our clients can receive a quality of care. So I can welcome too if there any addition to this crowded, you can speak. Welcome.
Thank you, Rita. As you have heard, my name is Tuli Hingi, and I'm here to add some challenges which we are facing during providing care at our hospital. As you see, the room is not big enough so that during giving care there is no privacy or confidentiality. And also we are supposed to have office at this ward. So we don't have office and our equipment and supplies are not in this ward. So in case of emergency, you have to run to the labor and delivery office for help. So, but also it is hard to transfer patient during, for those who are going for cesarean section, it's hard to transfer to and from the operating theater. And also it is hard to arrange. As you see the ward, it looks overcrowding all the time. So if we have a big room, a big space, we will give a quality of care to our patient. And finally, we thank the Shoulder to Shoulder for the scholarship they gave us in 2018 and 2019 for us to attend the APIC conference. These have improved in infection control. Rita and Dr. Sovello and I, we attended the conference in Minnesota in 2019 in Philadelphia. Thank you very much.
Thank you.
So what touches me in seeing these videos and hearing these voices is that these are places that Gary and I and our family and friends have been visiting year after year. We have seen and been part of the incremental progress over the past 18 years. The people you just heard from, Alamu and Dr. Benjamin and Rita and Tuli, they're our friends. Returning to visit year after year feels like a family reunion of sorts.
Well, you've heard from our colleagues in Tanzania and you've seen what it looks like there. I'd like you to just picture a new space that maybe has exam rooms for kids, room for prenatal care, family planning, immunizations, even maternal to child HIV transmission prevention. Yes, they have some difficult issues there. And a meeting room that could even double as space for the nursing school. This is what we envision with the new RCH. Glenn, I've been pacing around off stage like a nervous father whose wife's in labor. How are we doing?
Dr. Moody, I will tell you, Dr. Hurley just told me this privately right before I walked on the stage. This has now become the most successful event that Shoulder to Shoulder has ever done. We could not be more thankful and appreciative for your support. We are over $51,000 together so far. We're over $51,000. And let me just outline how critical this is. The first phase one of our project expansion, the total cost is $110,000. So together we are now over $102,000 towards that goal. We have met our initial goal for this virtual event to raise $51,000. If you'd like to continue giving or if you'd like to make a gift again to get us to complete phase one, obviously the Peter King Foundation will match every gift up to unlimited tonight. Matter of fact, every single gift that you give, we could not be more appreciative. And I need to thank some of the families and some of the donors that have made gifts tonight. We had an anonymous $10,000 gift that was given to us. A huge thank you to that family that made an anonymous gift of $10,000. Becky and Lamont, of course, Lamont serves on our board. Becky and Lamont Kerner, they made a gift of $3,000. Lamont and Becky, we are so thankful for all that you've done. We had an anonymous gift tonight of $2,000. Friends of mine, Ken and Bertie Olson, they gave $2,000. Dan and Sue McIntyre, they gave $1,500. Dan and Sue, thank you for your gift tonight. Many churches, of course, have rallied behind us tonight. We have Augustana Lutheran. They gave us a gift of $1,000. Thank you, Augustana and the congregation for that donation. Dan and Kathy Heist, they made a gift of $1,000. Dan and Kathy, thank you for your support. Lynn and Molly McLean, they made a gift of $1,000. Lynn and Molly, thank you. That is a gift of $1,000. Every single gift is making a huge difference for us. Obviously, every gift will make a difference and add to our total. Again, the Peter J. King Foundation will match every other gift. Dr. Moody, two last things. I was smiling to myself. My home church that I attend is Glory Day Lutheran. It's on Snelling Avenue in St. Paul, and I'm glad Lamont reminded me of this. Sometimes during the service at our church, they will send the offering around a second time. And so that's this moment when I offer you the chance, if you want to help us hit our stretch goal tonight to get to 110,000, you can certainly do that, which would be us getting to 55,000. We could not be more appreciative for everyone who's made gifts tonight for your generosity. And one final thing, Dr. Moody, I'd like to ask you this. When you think of this project, what is the most exciting thing to you about this expansion?
Well, Glenn, the OB business is the core business of the hospital. And with this initial phase, and then with development of labor and delivery, it really brings the little place into the future. So I'm very excited about the whole project. Let me say too, Glenn, you're invited to come. We'd love to show you. Seeing is believing. We'll reserve a spot for you in our housing. And by the way, after church, they do an auction, so you could do your first auction in Africa.
That would be a first. Believe it or not, I've been an auctioneer for 25 years, and I've never done an auction in Africa. Let me conclude my section by saying, for those of you who have not made a gift and you'd like to, obviously you can make a donation on the screen. You can text to give or just fill out the form. To everyone tonight, not only the folks that have donated, but everyone watching, we could not be more grateful for your support. It is remarkable to break this record. Next year, we will give you an update on the project and show you pictures of it. Thank you. Blessings to all of you during this holiday season. That is remarkable. Dr. Moody, we're at $51,905. So with the Peter J. King match, that is over nearly $104,000 that we've raised. Thank you, everyone, for all that you've done.
Thanks, Glenn. We're in very good shape here. I want to thank you all for being present with this, our first ever virtual Ilula event, and thanks for your generosity toward the people of Tanzania, and especially the mothers and children who seek care at the Ilula Hospital.
Gary, did you want to thank the doctors and nurses and staff at Ilula? And of course, we want to thank Dan Nygaard, our videographer, and Freestyle Productions for streaming the entire event. We want to thank Bo and Julie Skillman and Joe Darcy, who recorded videos in Tanzania for us. And of course, we want to thank Pastor Lamont Kerner, who did a lot of the production stuff for us. We'd like to thank our advocate team who spread the word of Shoulder to Shoulder in this event. And most of all, a huge thank you to every one of you who have donated this evening and throughout our 18-year history. Your generosity is a sacred trust you give us on behalf of our colleagues in Tanzania and all whom they serve. What you have given this night will have an enormous impact on the quality of health care for thousands of women and children who depend upon Ilula Lutheran Hospital. I want to just remind you folks that you may still donate after the program's over. The event website will be available until midnight tonight. After that, you can go to our website, www.ilulahealth.org.
Please stay with us for one final word by video from the folks in Tanzania.
Thank you so much. As we are going to round up this, Ilula Lutheran Hospital now become one of the big hospitals in the Iringa region. In number of the patients that we have been receiving day by day, the number of pregnant women is very high. As in number, in a month we can have 256 deliver, which is a very big number. What we need is the support from the Minnesota so that we can have the extension of labor and delivery, RCH, and other medical equipment. We really thank all people in Minnesota, shoulder to shoulder, all donors that have been spending their time and money to make sure that all this is possible in Ilula Lutheran Hospital. Thank you so much.